There are 3 stages to trauma recovery. This is based on the work of Dr. Judith Herman and her seminal book, Trauma and Recovery, from 1992. So I use a slightly different language, but it is the same idea that she created. So Dr. Herman was a psychiatrist, and she worked with lots of folks who had gone through significant childhood abuse. And in her book, Trauma and Recovery, she outlined 3 stages that are totally necessary to go through on a stepwise progression in trauma recovery. The first she called establishing safety. And this can be pretty hard when a person is in active danger. So I work at the addiction clinic, and folks there might have financial or housing insecurity. They might be facing interpersonal violence from their partner or somebody else. They might be in a home that's unsafe. There are so many possible reasons that they don't feel safe, and establishing safety can be hard. And I also work at the refugee clinic, and so many folks there have family that have either been killed or they remain in a refugee camp. And so establishing safety can be really hard because they might have survivor guilt, or they might have some kind of secondary reason not to recover. But for those that are able, I call this stage noticing. And the reason I do that is because establishing safety is really about learning your own nervous system. And this is because when we're getting to learn our nervous system, we get a sense of when we're in our window of tolerance, where we feel like we can handle things. Then we also get a sense of when we are over the window of tolerance. This is overactivated, sympathetic fight and flight, lots of movement and restlessness. We also start to learn when we are below the window of tolerance, which is an underactivated state, which is too much parasympathetic tone, which leads to freeze collapse response. So establishing safety is learning when you're on the windowsill, when you're in the window, and then how to get yourself back in the window when you're not. These skills help us understand how to shift our nervous system, which is an essential skill to get into phase 2. Phase 2, Dr. Herman called remembrance and mourning, and I actually call it shifting. This is the step where you rewire your brain. This is using neuroplasticity, or shifting the pathways and the neural networks inside the mind. And it's generally around the traumatic content, which is stored mostly in the amygdala. And yeah, we have 2 of them. So our amygdala is programmed to be protective mechanisms. It's kind of like a fire alarm in the brain, and it's scanning the internal and external environment all the time looking for danger. And when we've been through threatening experiences, it stores the traumatic content of those experiences in order to keep us safe, because it wants us to totally remember what it was like so we could keep an eye out and be aware if it's happening again. So the amygdala might store emotions, physical sensations, and the context of what was happening at the time of the trauma. So the goal of the second stage is to shift those associations stored in the amygdala. She calls this remembrance and mourning because you are accessing the traumatic content, and then you are grieving and letting go. And I like to call it shifting because you're really leaving the pain of the past in the past. The last stage is reconnecting. And so much of this is reconnecting to who you want to be outside of those reflex responses that your amygdala was creating. So you're learning, well, what are the things that I value? What do I want to prioritize? And how do I move towards those? This is the stage where post-traumatic growth can become much more attainable. Like it feels like it's something that you could get to. It's really hopeful. And these 3 stages aren't linear. It's not like you couldn't necessarily have a phase 3 moment when you're still at the early times. It's just a matter of safety, like psychological safety, to make sure that a person isn't going to freeze or flood, get overwhelmed during stage 2 if they haven't gotten through stage 1 yet. And this takes as long as it takes. For some folks, I would feel like they can get through stage 1 within a couple sessions, 3, 4, 5. And for others, it can take months. Part of this has to do with who they are, like all the social positions. So your gender, your age, your positionality in terms of whether or not you have other kinds of security. So that can factor in. the meaning that you've ascribed to the trauma and how much it's affected your life, which also has to do with how long these patterns have been stuck. So age can make a little bit of a difference here. And I find brains before the age of 25, they can rewire super fast. And there's no defined ending for that third phase. I mean, I do try to suggest to people that they are going to be okay on their own and they can check in when they need to. And for other folks, it's just really important that they have regular check-ins to make sure that they're not falling back into old patterns or having new trauma that they haven't really figured out how to integrate into the new way that they're feeling. So you can see how even though there are 3 distinct phases, it takes different amounts of time and this like non-linear journey through each of them. So it's super personalized. But it's possible to move through all 3 stages for anybody. Hope is the key.